I have been taking Flonase, Claritin, Zyrtec for these allergies, but they still do not work and I still feel miserable.
They're treating the symptoms, but not treating the trigger or the cause of their symptoms.
Welcome to your daily health briefing. I'm Dr. Albert Takem. This show is here to help you navigate the complex U.S. medical system, one step at a time. Whether you are decoding a new diagnosis, fighting for a referral, or just trying to stay informed, you are in the right place. Let's get into the science. I hear this all the time. The patient tells me, "Doctor, I have been taking Flonase, Claritin, Zyrtec for these allergies, but they still do not work and I still feel miserable." That is a very common problem. So today, I brought in my colleague, Dr. Khan, to help us understand why patients are suffering and being miserable without any help. So, Dr. Khan, what do you think is happening with this patient?
So, I think what's going on here is that they're treating the symptoms, but not treating the trigger or the cause of their symptoms. And so they're blocking a reaction through taking the anti-allergy medication, but whatever is triggering it for them is still there and it's still bothering their body. And so without proper testing, you're just sort of guessing around.
So the Zyrtec and Flonase are really not eliminating the problem.
Exactly. Yeah.
So the patient is taking them without any proof of benefit, but he doesn't know what else to do.
Exactly. So it's sort of a desperation move. You're like, something's got to stick, something's got to help. And then, this has an effect on your quality of life.
Okay. Yeah. And I guess the ease of purchasing these medications also make them very attractive.
Very
because
true.
I do realize that when you go to the pharmacy, there's an entire section there just for runny nose.
Absolutely. And the TV, there's commercials on all the time for allergies,
Yeah.
The symptoms are generalized, like runny nose, runny eyes, or you're coughing a lot, or you may even have a rash, but you think of that as an allergy, and then you just start taking some allergy medications.
Are you saying that patients are oftentimes just treating something as allergies that are not really allergies?
Exactly. One of the big things is that you can have non-allergic reactions, and then you can have allergic reactions.
Okay,
and
good.
So,
that's a nice segue into the science. So can you explain to us the difference? What is an allergic rhinitis and what is a non-allergic rhinitis? How do they manifest?
Absolutely. So when you're referring to allergic rhinitis, it could be any kind of trigger, whether it's like a pollen, whether it's a cat, whether it's exactly environmental, exactly all of those kinds of things. There's a specific trigger that your body is reacting to, and that's what an allergy is. An allergy is when your body overreacts to something that should not cause that kind of a reaction, versus non-allergic rhinitis, where it's not coming from a specific cause of an allergen, which could even just be a smell that triggers something. So it's not coming from a specific allergen, is just sort of something that's happening in the body where your lining in the sinus areas in the nasal cavity is inflamed.
Okay.
Yeah.
So Dr. Khan, for the patient sitting at home with all these symptoms and trying to figure out which one do I have? I just heard you guys talk on this podcast about allergic and non-allergic rhinitis and, just flew over my head. How does the patient process or utilize this information? What should they do?
So that it can be hard for a patient to do that, not because they can't figure it out, but because sometimes you can even have both. And so sometimes it can even be a little bit of work for your doctor to figure out. But the first step, if you see that you're trying to treat something and it's not improving, then come talk to your doctor. And so one of the first things we'll do here at our primary care is we'll allergy test you. An allergy skin test will then look at 48 very common triggers that you could have that might be causing the reaction for you. To give you guys a little bit of information, how that looks is we inject you with very, very small amounts of these allergens, whether it's pollen or dander or ragweed or grass or whatever it could be, and a very small amount. And if you're allergic to something like that, what you'll see on your skin is a red dot. It'll swell up, so that gives us that indication of, oh, you have an allergy to this. And so now we know, hey, you're having an allergic reaction to something, and then we will go into the treatment for that. versus if you have, say you do the testing and everything's negative, then this is more so indicating a non-allergic rhinitis, and then you'll go into the treatment arm for that. But they're two different treatments.
They are.
Yeah.
So how are the treatments different?
So when you test positive on the allergy test, one of the best and newest forms of treatment is immunotherapy. But immunotherapy, and sometimes patients don't know that this even exists, but what it aims to do is that over time, it's going to eliminate the allergy for you. You'll sit with your doctor and we'll put you on this kind of a treatment, and over time, you will improve to the point where you're not allergic to it anymore.
So it's sort of retraining your immune system not to react to these allergies.
Exactly, because like I said in the beginning, allergy is it's a reaction of your body, and it's an overreaction of your body. And if you want to be very scientific, I'll tell you that what's responsible for that is it's histamine. And so when histamine comes out into your blood, it causes this systemic sort of reaction. That's why allergies can be so severe. And you can even go down what I'm sure you heard of is anaphylaxis, like a very serious reaction to it. And so with immunotherapy, over time, all of this will sort of go away.
So what are the consequences of dealing with allergies? If somebody says, hey, you know what, I get these allergies every year, and, sometimes twice a year, and, I'm just going to live
put up
with
it.
After
so that's
said by patients
that's also
times.
Can be dangerous because if you look at the statistics, a lot of people who have these chronic allergies that have never been treated, never been taken care of, you can actually go down and develop asthma. And now you're going to be dealing with a whole nother lung condition that'll add on to all of these other symptoms and make it much worse for you. So the key summary that I want everyone to know is if you're trying, allergies are common and they're over-the-counter treatments for a reason. But if you're trying to do something and treat it and it's not improving, then it's time to come talk to your doctor.
Okay. As we wrap up this episode, what is the one takeaway you'd like the viewers or listeners to walk away with? If there was one thing you could tell them.
If your symptoms are excessive, number one, so if you're having shortness of breath, you're having rashes all the time, you're seeing swelling of any sorts, you need to come talk to your doctor immediately. For other generalized symptoms, if you're trying to figure it out and you haven't had a solution yet by, taking the Zyrtec or the Allegra or whatever it is, and you're still in the same boat, it's also time to come talk to your doctor so that we can test you appropriately and figure out which group of people you fall into, allergy or non-allergy, and then treat you accordingly.
Well, you guys heard Dr. Khan. If the pill isn't working, make sure you stop guessing and start testing.
Exactly.
We'll see you next episode. Thank you, Dr. Khan.
Absolutely.
This has been the Daily Brief. Medicine is not about certainty. It is about responsibility. Decisions are often made with incomplete information, but they are always made with your safety in mind. In a system that can feel rushed and fragmented, you deserve clarity, continuity, and an advocate who sees the whole picture. I am Dr. Albert Takem, your physician ally, high-level science, human-level care. I will see you at the next briefing, or I will see you in the clinic.